Hello, I'm Dr. Praveen Ravishankaran, a robotic surgeon working in the beautiful city of Coimbatore. Over the years, I have the privilege of treating patients across a wide spectrum of cancers using cutting edge technologies like laparoscopy and robotic surgery. My work is focused not just on removing cancer, but on doing it with precision, minimal pain, faster recovery, and better quality of life for my patients, which I feel is very important. Every surgery I perform is a balance between science, technology, and compassion because behind every diagnosis is a person, a family, and a story. Through this platform, my goal is to simplify complex cancer care and bring clarity, awareness, and confidence to people who need it the most. Today, I want to talk about a cancer that is different from almost every other cancers we have discussed so far because we actually know what causes most of the cases of this cancer, and more remarkably, we have a way to prevent it before it even begins. Cervical cancer. But before we get into that, let me show you something. Here is a simple line of dominoes, each one standing close behind the next. Watch what happens when I tap just the first one. One small tap, and the energy travels all the way down the line, each domino knocking the one after it until the very last one falls. Now watch this time. I'll set it up again exactly the same way, but I'll simply lift out this two dominoes and right near the start. I give the exact same tap also, and the chain stops right there. Everything beyond this point stays standing. Now hold on to that thought. Now many of you may have watched Contagion, a film where a new virus spreads rapidly across the world, city by city, person by person. And if you remember, almost the entire second half of that movie is actually a race against time to develop and distribute just one thing, a vaccine. Because once people are vaccinated, before they are ever exposed, the virus simply cannot take hold and spread the way it did before. That exact principle, stopping something before it ever gets the chance to start, is at the very heart of how we now approach cervical cancer. The cervix is the lower, narrow part of the uterus that connects it to the vagina. Unlike most cancers, where the cause is often unclear, we know precisely what drives the vast majority of cervical cancer cases: persistent infection with certain high-risk strains of Human Papillomavirus or HPV, particularly type 16 and 18, which together are responsible for around 70% of the cases. The most common type by far is squamous cell carcinoma, arising from the cells lining the outer surface of the cervix. The second most type is adenocarcinoma, arising from the gland cells lining the cervical canal. Both are strongly linked to persistent HPV infection. Now let's talk about where India stands because the numbers are striking. Cervical cancer is the second most common cancer among women in India after breast cancer and one of the leading causes of cancer death in women. Every year, about 1,23,000 women in India are newly diagnosed with cervical cancer and close to 80,000 lose their lives to it, which means India alone accounts for up to a quarter of all cervical cancer deaths worldwide. To put that into perspective, a woman in India loses her life to cervical cancer roughly 1 every 7 minutes. And here's the part that troubles me the most as a surgeon. Despite all of this, fewer than 2 out of every 100 eligible women in India have ever been screened for cervical cancer. This is not a disease we don't understand. This is a disease where the gap between what we know and what we do is costing thousands of lives every year. Persistent infection with high-risk HPV is by far the most important risk factor, and HPV itself is extremely common, spreads through skin-to-skin gentle contact, and most sexually active people are exposed to it at some point in their life or the other. In most people, the immune system clears the infection on its own. But in some, the infection persists for years, gradually causing changes in the cells of the cervix that, if left undetected and untreated, can slowly progress to cancer. Other factors that increase the risk include smoking, weakened immunity, multiple sexual partners, and critically, never having been screened at all. In its earliest stage, cervix cancer often causes no symptoms at all. As it progresses, Women may notice abnormal vaginal bleeding or discharge between periods, after menopause, or after intercourse, although with unusual discharge or pelvic pain. But by the time the symptoms appear, the disease has often been already spread or is very advanced. This is precisely why prevention matters so much more here. Screening is how we catch cervical cancer at its earliest, most treatable stage, often before it becomes cancer in the first place itself. A Pap smear looks for abnormal cells on the surface of cervix, while a HPV DNA test checks directly for the presence of high-risk HPV strains. If either of these becomes abnormal, we perform a colposcopy, a closer magnified examination of the cervix, and take a small biopsy if needed. The goal of screening isn't just to find cancer, it is to find and treat precancerous changes years before they could ever have the chance to become cancer by itself. And this brings me to what I believe is one of the most hopeful stories in all of cancer medicine, the HPV vaccine. Because HPV causes the vast majority of cervical cancer, and because the vaccine prevents infection with the high-risk strains responsible for most of them, studies have shown that HPV vaccine is over 90% effective in preventing cervical changes that leads to cancer when given before a person is exposed to the virus. That is why it is recommended for girls between the age of 9 and 14 years, ideally before the start of sexual activity, though it can still benefit older individuals as well. For years, cost was a real barrier in India, with the imported vaccine priced at about 10,000 rupees per dose. That changed with Cervivac, India's own indigenously developed HPV vaccine from the Serum Institute of India, priced at a fraction of the cost. And in February 2026, India took a landmark step, launching a nationwide HPV vaccination campaign, offering a single dose of HPV vaccine to 14-year-old girls throughout schools and government health centers as a part of universal immunization program. This aligns with the World Health Organization broader elimination strategy, which calls for 90% of girls to be fully vaccinated by the age of 15, alongside regular screening, a combination that for the very first time makes elimination of cervical cancer a realistic goal within our lifetime. When cervix cancer is detected, treatment depends on the stage. Very early microscopic cancers can sometimes be treated with minor procedures that remove just the affected tissue, preserving the rest of the cervix and the uterus. Important for younger women who wish to have children. For early stage diseases confined to the cervix, surgery to remove the uterus and the surrounding tissue along with the lymph nodes is often the treatment of choice. For more locally advanced disease, a combination of radiation and chemotherapy is typically used. The choice between minimal invasive and open surgery is decided individually based on the stage, the patient's anatomy, and what is the strongest available evidence which shows the best possible outcome. Because in cervical cancer, getting the decision right matters as much as the surgery itself. Now, coming back to our beautiful dominoes. Think of that falling chain as a natural cause of cervical cancer. It usually begins with a persistent HPV infection, which over years causes precancerous changes in the cervix, which if undetected can eventually progress to invasive cancer. This is the chain reaction. Vaccination is like removing a few dominoes, preventing the infection that starts the whole sequence before it ever begins. And screening is like halting the chain midway, spotting and removing the precancerous dominoes before they ever get a chance to topple into cancer. Together, vaccination and screening don't just treat cervical cancer, they interrupt it at its very source. And that brings me to the most important part. Cervix cancer is one of the very few cancers we can realistically aim to eliminate, not just treat, but prevent it from happening at all. A single vaccine given at the right age combined with regular screening throughout adulthood can do for a generation of women what no amount of surgery, chemotherapy, or radiation can do once the disease has taken hold. If you have a daughter, a niece, or a granddaughter between the age of 9 to 14, please talk to your doctor about HPV vaccination. And if you're a married or a sexually active woman, Please do not skip your screenings even if you feel completely fine. Feeling fine is exactly how this disease likes to hide. We are living in an era where for many cancers, the conversation has shifted from treatment to prevention, and cervical cancer is leading that shift. With India's growing access to affordable vaccination, a new national vaccination program, and improved screening infrastructure, we have, for the first time, a realistic pathway towards making the disease completely disappear. But that path only works if awareness reaches every home, not just every hospital. So I urge you to be aware, to be proactive, and never ignore what your body is trying to tell you. If this video has helped you understand cervical cancer and the importance of HPV vaccination better, do share it with someone who might benefit from it, especially a parent or a young girl. Subscribe to the Wellness Oracle for more clear, practical, and evidence-based insights into cancer care. Stay informed, stay strong, and I'll see you in the next video where we continue this journey of understanding and fighting cancer together. Thank you and have a great day ahead.